We remember 2010 when former Rutgers football player Legrand experienced a life-changing spinal cord injury after a collision on the field. It left him paralyzed from the neck down. In the last 4 years, he has dedicated his life to raising awareness of spinal cord injuries, and Eric joins us today along with Dr. Steve Aiden of Manhattan Spine and Pain Medicine. Good morning.
Good morning.
Good morning.
Eric, how are you doing since the accident, and what are some of the major milestones you've hit along the way?
I've been able to, recover, greatly so far since my injury, especially since the original prognosis looked very, very dim. And, I've been able to breathe on my own now, eat solid foods, but physically I'm able to move a lot more trunk control. My fingers get to move every now and then. I can get them to twitch. I have movement in my shoulders, a little bit to my elbows. Just got to get my bicep going now so I can curl my arm up. But things are coming back for me, so I'm working my butt off 3 times a week into therapy, and things are looking great. Of course, I wish I was walking already, but the process has been well so far.
Soon after your accident, you experienced pain associated with your injury. How did you learn it was nerve pain and not something else?
Yeah, actually, it was a day or two into it. I started feeling pain and burning sensation through my legs and body. I'm like, oh, I wonder if my body's waking up. So, of course, I went and asked my doctor right away, like, what is this? Is my nerves waking up? And she explained to me, no, it was actually nerve pain. Something that it really affects people with spinal cord injuries. And fortunately, somehow my nerve pain went away a few weeks later. But I saw patients that were dealing with it, and it looked like it was very excruciating, and it affected their therapies and the things that they were doing in therapy. So I was just like, wow, this is really something serious, and that people need to really be educated about this and talk to their doctors about dealing with nerve pain.
Doctor, can nerve pain associated with spinal cord injuries be treated?
Yeah, it certainly can. There are many patients who have spinal cord injury. About 40% of those patients will end up having what we believe is called neuropathic nerve pain caused by spinal cord injury. And it can be treated. For a long time, we used medications for off-label use, meaning that they were used for something else, but we found that they were helpful for treating the nerve pain. But in 2012, the FDA came out with an approval for using a medication called Lyrica, which is indicated for spinal cord injury with neuropathic type pain. And basically that treatment, those modalities can be used to help manage the symptoms. Now, with any medication that you use, you need to weigh the risks and benefits, understand that there are side effects, and discuss it with the doctors that are treating you to see if it's a treatment option for you.
Eric, what do you want patients and their caregivers to know about this type of injury?
When it comes to with this injury, you definitely got to be educated about it. My mom, she went through a whole process learning on how to just even take care of someone with a spinal cord injury. So I always encourage patients to talk to, of course, their physicians about the nerve pain, because they're doing studies and learning more on what type of medicines can help people that are going through this type of injury and dealing with the nerve pain. So definitely talk to your physician, but also try to learn as much as you can. Especially you can go to my website, teamlegrand.org, and I'm partnered up with the Christopher and Dana Reed Foundation to educate people on spinal cord injuries and how we're looking for a cure for injuries, but also helping people with the quality of life and educating them on how to live with the spinal cord injury.
Well, Eric, all the best in your recovery, and thank you both for your time.
Thank you.